Hi, my name is Ray, middle initial C. Some people refer to me as Charles, but sometimes they give me a lot of problems with Ray Charles Bagley. And my tenure with Dr. Carson started back in 2018, and it started as a result of a referral. And with my medical history, I worked at a company that was very concerned about their employees. And the physician at that company, they referred me to Dr. Jeffrey Carson at the time. And so that was my introduction to him. And they knew I was getting ready to go through another procedure, and I had one right after the other. And this is about halfway through, I would say, a legacy of 6 spine procedures. And on this particular one, which was going to be, I would say, my fourth one, they just knew that they wanted to give me better help. Relative to the company, they considered me a valued employee. Not that I was anything special, they would have done that for anybody, but I felt special because the company took concern to try to get their employees the best help. So that was my intro to Dr. Carson. That first surgery was a cervical surgery, and from that surgery, it really changed my life. And from that, the professionalism that I experienced from Dr. Jeffrey Carson and his team, his staff that I got a chance to work with, to be introduced with and work with, they were just phenomenal. And of course, again, that was in 2018. And then, unfortunately, or fortunately, depending on how you want to look at it, because I did have a history of degenerative disc disease and spinal stenosis. And so the older you get, as you get my age now, which I will not tell you what that is, that becomes more challenging. And so in 2019, I had to come back and visit the doc again. And needless to say, this time it was another surgery that had to do with the spine, but instead of the top, it was the bottom. This is when I had my fifth one, which was the lumbar area. I think it was L4, L5 in that particular area. He took care of me there. Then, of course, I was back again for another one. This particular one was a meniscus, so I couldn't get my mojo going and kind of get good health and good running. But I had the confidence in him that every time I came, with the way he explained things to me, he explained things to my family. We were just so confident that when we left, that when we came out of that surgical procedure, things were going to be better. And actually, up until, as I expressed this last one, it happened that way. And then this last surgery, which took place this year, in fact, it was November the 14th, it was a procedure that I did not see coming. In fact, if you say, was I having problems before? Probably yes, and really didn't know it. But I think June of that year, I ended up getting rear-ended, and I just think it accelerated what possibly could have been already happening. And so pain set in and never left. No prescribed medication was able to give me any comfort. Sleeping was it was just horrible. And I just went for several months with chiropractor. That's the route we took first. That wasn't doing it. Then from chiropractor, it was chiropractor and physical therapy at at the council of people who I trusted. And then I just got to the point. I said, "Hey, this is not really making me feeling it better. I'm not getting better from this." And so I went back to my PCP, and after I explained to her what was happening, she said, "Let's do an MRI, and we're going to find out what's going on." And that MRI is what led me back to OSC with Dr. Carson when it came to him evaluating my MRI, because she knew my history with him. She knew how much I trusted him. So she was, she didn't have to tell me to take the MRI and go to him. She already knew I was going to do that. So we got that information. He explained to us that it was a synovial cyst that had developed because I had bone rubbing together. He said that injury could have accelerated what could have been going on, and that cyst was pushing up against a nerve between L4 and 5. and that was causing all the pain, that severe pain, down my left leg, hip, calf, foot was going numb. I felt like I was a burden to my family. I couldn't walk. We go grocery shopping. I couldn't walk through the market. I was too embarrassed sometimes to get on one of those little handicap carts, motorized carts. But needless to say, I ended up getting on a few of them at the end because it was just so unbearable. Other places we went, if I did decide to go, I would sit in the car, or I would go into an establishment, and the first thing that I would look for, instead of just walking and having that quality time with my wife and family, I would look for a seat, and of course get left behind, and they go and do what they want to do, and then come back and pick me up, and then we leave. In the explanation, he said, Mr. Bagley, he said, we can fix this. And I said, Doc, I believe that you can. I'm trusting that you can. I said, the only thing I want to know is how soon can we do it? And needless to say, he just kind of directed me to the scheduler. And it took longer than what I wanted because I told my family, I said, I've never been so excited to have a surgery. Who in their right mind are anxious to have a surgery? I was just in that much pain, but with the confidence in this practice and the team that works here, that they were going to get me out of it, that I was anxious for the surgery. I was calling the scheduler every week and say, put me on the call list that if anybody drop out, I'm willing to take their place. And it happened to be the first schedule was on my birthday, November the 1st. And she said, well, you certainly, would you want that? I said, I'll take it, November the 1st. So when November the 1st started approaching of 2022, what happened was my insurance declined me based on the procedure that Dr. Carson was advising. And this is what I really love, and this is why I'm so glad to do this and tell people about this story and give them hope as well, is that Dr. Carson stood by his principles. He stood by what he felt was the best care for me. He stood by what he felt was going to be the best care for the quality of life. Coming back, that if I didn't get it all, I would get most of it. And he wanted to re-engage me back with my family, which he knew from my explanation that I was severely or grossly missing. He, his team, they helped me through the appeal process. I understand that it takes 30 days. We got through the appeal process in about 7 to 10 days. And after I got the call from the scheduler saying, hey, we ready, because I was hitting the insurance company too. So we found out about the same time that it was actually approved. Scheduler called me that evening and say, hey, it's approved, we can do it tomorrow. I said, I can't do it that quick, I gotta prep. So we went through the weekend prepping, and then that Monday on the 14th, from the 1st to the 14th, that's when the actual surgery took place. When I came out, you're all drugged up, so you're still feeling pretty good. We got the prescription, and then within the first day or two, I was kind of like, okay, I'm not gonna say anything, maybe it's the drugs. But all the pain that I was experiencing in my left hip, thigh, calf, the numbness in the foot, all of that immediately disappeared. And I was so excited. And people who know me, they know my excitement turned into physical activity, but I knew I couldn't do but so much because of the degree of the surgery and the instructions he gave me to care for myself. And I got off narcotics within, I think, the second or third day, and really the pain wasn't. It was something that I could really bear. The in-home care team, PT, physical therapy, they came in the next day after therapy and started working with me. And before they left, they said they hadn't seen anything like it. They hadn't seen anybody recover that fast, did that well with the PT. And I came back from my post-surgical follow-up with Dr. Carson and his team. I was hearing the same thing from the lady who removed the stitches. And by the time I got to Dr. Jeffrey, it was high-fiving. I told him, I just want to hug you, man, because you have just given me my life back, and you have no idea the value of that. He takes the time to explain, walk you through the MRI imaging. He allows for questioning. Even every time I could come to his office, I get up beside him and we walk through the x-ray together, and he's explaining. Of course, I've done some research in advance to, somewhat know what questions to ask. But he fills in the gap with all the things that I needed to know. And my wife, who's probably a little less than active when it becomes, pursuing these kind of things because she hasn't had these health issues like me. Um, he explains it in such a way that is so simple that she is able to understand it. And when I look at her, her head is going like, yeah, let's do this as much as mine is like, do this. So professionalism, his explanation, I mean, he is just a scholar. Modern technology in the medical field, it has advanced so much in decades, and it's advancing faster than every month and year. And this practice, from my recent study, just going to the website, they keep up with the advancements. And when the patients come in, like myself and others, they are able to explain not what took place 20 years ago, that people didn't have a lot of good experiences, but they will kind of walk you through what's happening now and give you the options, because I had two options that I could have taken. One would have been a short-term fix. That was what the insurance company was advocating. Second one was a long-term fix, which that's what Dr. Carson and my wife, agreed to. So when we got declined and he stood by me, that's because he has been keeping up, his practice has been keeping up with what works for people, what would give them that longevity and give them that quality of life, which is a big term for me now and became even more special to me, being down and then back up again. So when people come here, whether you're a current patient or you're thinking about coming to this practice, I would advise you to do research. Go to their website. They have a lot of videos where they're willing to train you, and you can actually connect with the practice in various sessions on things that they're talking about, from the spine, from the knees, and things that they do in this practice. And they give you practical help that is beyond that after you leave them, that will help you continue to move forward with a good quality of life. This process with me started in 2003, and I tell you, if I had to do it again, which I pray that it doesn't happen, this would be the practice I would come back to without a second thought at all. But with Dr. Carson, he is very high on my list, and I'm a hugger. And I tell you, I think when I come back on my visit next week, I am gonna hug him. So tell him get ready for it.